Hi all, this is Murshida Yasmin, Assistant Professor from SNS College of Physiotherapy. Today I am going to talk about the assessment of neurological reflexes. Neurological reflexes plays a key role in the assessment of neurological condition. There are basically two types of neurological reflexes, superficial and deep reflexes. In this presentation, I am going to explore the crucial role of reflex testing in neurological assessment. Starting with the introduction, the clinical importance of reflex testing are the first one is diagnostic tool. So the reflex testing will act as a diagnostic tool which helps us to pinpoint the neurological condition and localizes where the lesion is present in the brain. Next, the reflex testing will act as a prognostic indicator which offers insights into disease progression or we can predict the recovery of the patient. Then the reflex testing will act as a guidance for the treatment, which informs the therapeutic strategies and also it will help us to plan the goals and the means of the intervention. In this picture, you can see the basic reflex arc, which is the basis of the neurological pathway. In this picture, let's start with the cutaneous ending. The cutaneous ending is nothing but which is a sensory receptor. The sensory receptor detects the stimulus. Once the stimulus is detected, it will be carried as a signal through the afferent neuron. The afferent neuron will carry the signal from the sensory receptor to central nervous system through the integration center called spinal cord. The spinal cord processes the information from the sensory receptor, then it will be sent to the central nervous system. The central nervous system recognizes what kind of stimulus is that, then the stimulus is processed, then the signal will be carried from the central nervous system to the motor system through the efferent neuron. So the efferent neuron will carry response from the central nervous system to the motor system. So the motor system, which is a effector organ, will receive the signal through the efferent neuron from the central nervous system. Then the muscle contraction occurs. So this is the basis of the neurological pathway of reflex arc. Through this only, the reflex is produced in our human body. So coming to deep tendon reflexes, so there are deep tendon reflexes in upper limb and also in the lower limb. In upper limb, majorly there are three reflexes: biceps reflex, triceps reflex and brachioradialis reflex. So biceps reflex, in which the root value is C5, C6. So it is tested by tapping the biceps tendon with the arm in mild flexion. Then the triceps reflex, which is having a root value of C6, C7. It is tested by tap or strike over the triceps tendon above the elbow. Next, the brachioradialis reflex is tested with the tap on the radial styloid process. So, which root value is C5, C6. So, if we tap on the tendon, there occurs the response called reflex, which is a mild jerk in nature. Next, the lower limb deep tendon reflexes, which are patellar reflexes, SLS reflexes, ankle clonus. Patellar reflexes, root value of L2 and L4 is tested by strike on the patellar tendon below the kneecap. So we can expect a jerk in the knee joint. Next, the SLS reflex, so which root value is S1, S2. So this is tested by dorsiflexing the foot of the patient and a mild tap in the Achilles tendon. So there occurs the mild jerk in the ankle joint. Then ankle clonus. By doing a rapid dorsiflexion, a sustained contraction will occur. So that is the response of the ankle clonus. Next, you can see the grading system in the reflex. So that is a deep tendon grading reflex. So in which this reflex is grading is used for the clinical scaling and the interpretation of the clinical condition. So it is basically a 5-point scale which is a grading deep tendon reflex system. So it starts from 0 and the 1 plus, 2 plus, 3 plus, 4 plus are the grades of the deep tendon reflexes. 0 indicates there is a no reflex, which is a absent reflex, otherwise called as areflexia. 1 plus indicates diminished reflex or mild reflex, which is near to normal but not normal one. Next, 2 plus is a average one, which is considered as a normal reflex. 3 plus is a brisk, which is above the average, that is possibly considered as an abnormal one. Then 4 plus is a hyperactive reflex with the clonus. So this is the interpretation system which is used for deep tendon reflex grading. Next, coming to superficial reflexes, plantar reflex, which is called as Babinski sign. In this picture, you can see with a blunt ended an object, the stroke on the lateral aspect of the sole of the foot is done. So, if the patient is normal, the normal response will occur like the plantar flexion of the toes. Next, if the patient is abnormal or if there is any pathological condition present in the patient, the Babinski response will occur, which is a positive Babinski sign. So that will depict like dorsiflexion of only the great toe and the fanning of the other toes will occur. So, the dorsiflexion of the big toe and fanning of the other toe suggests the upper motor neuron lesion. So, we can come to a conclusion if a Babinski sign is positive, it suggests the upper motor neuron lesion present. Next superficial reflex is a abdominal and cremasteric reflex. How we can assess this? Let's see. Abdominal reflex is assessed by stroking abdomen towards the umbilicus as shown in this picture. So if the person is normal, the umbilicus deviates. If the person is having any pathological condition or the abdominal reflex is absent, that indicates the pyramidal tract lesion. Then cremasteric reflex is tested by stroking over the inner thigh in the males. So, which is usually tested in the males. If the person is normal, the testicle will elevate during the reflex testing. If the cremasteric reflex is absent, if the testicles are not elevate, that indicates a spinal cord injury at the level between T12 to L2. Next, the clinical correlation with the help of the reflex testing. If the reflexes are abnormal, we can localize the lesion based on the reflex assessment results. So, first one is hyperreflexia. If the reflex is 3 plus or 4 plus in grading, which indicates the upper motor neuron lesion. If the reflex is 1 plus or 0 according to the grading, which indicates the lower motor neuron lesion. If the reflex is asymmetrical when compared with the both the limbs of the patient, then we can come to a conclusion, that is, there is a unilateral lesion is present in the patient. So understanding the reflex abnormality helps precisely to localize the neurological damage. Next is the conclusion. To conclude it, integrated reflex assessment for the neurological diagnosis. So, with the help of the reflex assessment result, we can integrate the other results of the assessment and we can come to a conclusion for neurological diagnosis. For that, we have 4 steps in the conclusion diagnosis. First one is the observation. The second one is testing. Third one is grading. Fourth one is correlation. First one, we have to observe overall patient motor performance. And the second one, we have to test both the superficial and deep reflexes systematically. We should not skip either the superficial or deep reflexes. By testing both the superficial and deep reflexes only, we can come to a conclusion of what type of lesion is that and what neurological condition is present for the patient. Next, the grade 3. Third one, the grade is the reflexes responses accurately. We can able to accurately conclude the reflex with the help of grading only. The fourth one is correlation. Finding with the patient history and also the other examination should be correlated with the neurological reflex assessment. Then only we can come to a conclusion of what type of lesion is there and where the lesion is located and what condition is present for the patient. So reflex assessment is basically plays a vital role in assessment of neurological condition. With the help of this grading and also with the understanding of the basic neurological reflex arc, we can easily understand the reflex assessment. Hope you find this video is helpful for studying the reflex assessment. Thank you.